our job is to put forth the best team, put forth the best imaging and diagnostics and the best treatments. And I think when you get to see that come together, that really is priceless. New Mexico is an underserved population for sure, in all specialties, but for sure in retina as well. And so we had some unique challenges in New Mexico. We had to be, number one, very efficient, and at the same time wanted to provide world-class care. And so in order to do that, we really needed to figure out ways to do things better. And so that's one of the big things that we do at Retina Consultants of New Mexico, is constantly look for better ways to do imaging, better ways to do surgery. Every aspect of what we do has to be more efficient and preferably at an even higher quality. Ophthalmology is the crown jewel of all of medicine, mostly because of our ability to image and the things that we can see, measuring things down to the cellular level, and really allows you diagnostically to make a really great diagnosis, while at the same time tracking a patient over time to see how they're responding to whatever therapeutic you're using. When I started residency, we were still looking at OCTs on printouts, and we've come such a long way to be able to scroll through every line of an OCT over the entire time period that you've seen a patient is critical. And then being able to look at the clearest color images along those times and how you might have had visual field changes, and being able to integrate that seamlessly and quickly is really important. The SL800 is sort of the workhorse or the foundational unit of our retina practice. Residents and medical students, as they get to participate in that exam and see what you're seeing and get pointed out the finding in real time, it's something that we've embraced. We're really excited about it. I think we're going to have a lot more medical students interested in ophthalmology as a result of that technology. One of the cases that we're going to talk about is a chronic macular hole that presented, had been there for several months. Those are always tough cases. Vision that can be limited even if you successfully close it. They can be incredibly difficult to close to begin with. And this particular case was that. We first started with an interlimiting membrane flap to try to pull that hole closed. That did not work. A doctor might have said, we tried, we gave it our best shot, and we're not going to be able to do much more from here. Thanks to amniotic membranes, for instance, we're able to go in and actually give a scaffold to pull that hole closed. It's incredible technology. It's something that gives these patients some hope of, instead of continuing to have vision decline, in many cases we actually restore some vision and stabilize that retina for them. Every single retina specialist out there, we all feel the same. And so when it comes to the investment in imaging and diagnostics, therapeutic, and surgery, to me it's a no-brainer. It's how I want to live. I want to be on the edge. Was this on?